Alright, for everybody watching, this is what me and Angela go through nightly on getting her set up for bedtime. This is her IV bags. She's been on a few bags already today, but this will be the one that she'll be going through tonight. First off, you just got to prime the tubing. Make sure no air bubbles are coming out, or no air bubbles get in the bloodline. I guess that's what they call it. Once you're primed, I'll go ahead and do this since it dropped into the, basically you just have to make everything sterile, clean it with alcohol wipes or whatever. My wife's on a medication called Finagrin. It's a medicine that we hook up to her IV nightly. Comes with a syringe, a little 1-dose bottle. This is the bag of Finagrin. Well, this is a bag of saline that the Finagrin I'll inject into. Shake that up. We'll hook her up to this here in just a second. And stick the needle in there. Inject the medication in. One thing with having kids, just got to pay extra attention to where you're disposing of the needles. We have catch cans that we use that they supplied. Keep them up, locked up high. That way the girls can't get to them since they've learned how to climb over the last probably 6 months. This has to be up here. It comes with an extension. Usually the tubing they supply with this is a little bit shorter than this one. This is usually something takes about 20-30 minutes depending on how fast you set the drip on it. Normally takes about 5 minutes, and my wife is completely out of it, incoherent. Makes for interesting conversations if she does happen to wake back up. Like last night.
We don't need to go there.
Needless to say, if there's a emergency, need to go to the bathroom, I had to walk her in there last night, make sure that she didn't fall down and trip over the IV. Being hooked up to this, this travels wherever she goes.
Hopefully.
And being 6 foot tall, trying to clear doorways, everything else. As you can see, it can be an experience. Just again, precautions just in case I touched it, that sort of thing. We'll set this up here. We'll be hooking her up to that in just shortly. These are 2 items that we'll be injecting into her IV. The first one's saline. It's a 10 milliliter syringe. You usually have to inject 5 milliliters in to just kind of clear the previous blood out of the IV line, the vein, I guess. This is heparin. This is an anti-blood or anti-clot or blood thinner. Basically, like I said, it keeps the vein open. especially when, like in the mornings when we disconnect all the IVs and everything. We'll administer these two, and that way she can disconnect, she can be good throughout the day for about 8 hours before we'll have to use the heparin again. So we got that. We've got both lines cleared, primed, ready to go. This is the third item that we'll be doing tonight. This here is the what's called a Zofran pump. This is her bag of Zofran. Comes refrigerated just for storage, and then it'll go in her fanny pack that she has to carry. Very fashionable, as you can see. Unfortunately, we haven't came up with many colors for the fanny pack to be able to match, so that's something that she has to deal with. This pump, like I says, battery operated, and it just administers medication throughout the day. It's anti-nausea medication. We've got medication in here, no beeping for low battery and things, so we should be good. If the battery does go dead, that's a whole nother process, swapping out the batteries, restarting the machine, and everything like that. But all this is the old lines that she just disconnected from. Disconnect old tubing. Reconnect the new tubing. Again, always steering clear from all the connection points to remain sterile. This is just a hold tube. It connects here, just so that until we get prepped to plug this in.
You have to prime it.
True.
Let me do it.
Sure. Well, I can do it. Go ahead and do it on the pump. Basically what she's doing here, she's priming that tube line. All the lines have to be primed. Just keeping the air bubbles out of her blood system.
Bring it closer over here.
There comes the medication. It comes up here. You can see it. Alright, this one's primed. Now this is the this is basically the needle, and it's got a little plastic cap here. This is basically used to hold so that you can basically I say throw it like a dart. It can either be administered or in the leg, probably from the thigh, anywhere half point over in the fatty tissue, either leg. With Angela, she's on it daily, and we usually do this 2-3 times a day in a 24-hour period. Sometimes more, depending on the sites. There's been times when I've stuck her with the needle, and automatically it hurts, so we pull it out, get a new kit, restart. As you can see, the needle on it, I'll go ahead and pull it off. The needle's about maybe 1/4 inch, 1/2 inch long. The needle holds a plastic catheter, I guess you would call it, that will stay in the insertion point. And in this cap here, it's got 2 prongs. Just kind of squeeze those, and this whole part pulls off of the bandage area. This bandage holds the plastic piece in that's going to be this part, pull the blue part off. Once I pull this part off, this bandage area stays on the skin. Then it leaves a little, basically a cup area that this will clamp down on. With the pump, she'll start the medication, and it administers the anti-nausea medication throughout the day. So between the Phenergan at night, Zofran during the day, all it is to help get through the what I call all-day sickness. Most women, that are pregnant, they deal with the morning sickness through maybe first or second trimester. Angela's from probably the previous two pregnancies and this one, she's dealt with all-day sickness. I'm going to show you, since I've got a little bit of flab on me, another area that we can stick. Basically here, either in the fatty tissue on her stomach, basically you pinch and then poke with a needle. Supposedly not too painful, as long as I get the timing right, do it quick, and like I said, as long as we don't go in at an angle, or if we hit blood vessel or something like that, usually, like I said, it's pretty painless. So we went over the regular IV bag, primed it, got it ready to go. The Finnegan bag, the medication's in the bag, mixed up. The IV line is primed, ready to go. We'll be plugging her up to this, and then the Zofran pump. So these are the 3 stages that we go through nightly. In the morning, when we wake up, well, let me back up a step. We're going to hook her up to the Zofran pump, the needle. Then I'm going to hook up to the Finnegan bag. Probably 20-30 minutes later, I will disconnect this, run a syringe of saline through the IV line, and then I'll hook her up to the IV bag. Then in the morning, usually about 8 hours later, wake up, pull the IV bag off, run a syringe of about 5 milliliters of saline, 3 milliliters of heparin. That way she's good to go. About 8 hours, she can move throughout the house. Depending on her energy levels, that sort of thing, dehydration levels, she might need to go back on another IV bag. That's something that she's been pretty good at being able to do herself, depending on where the IV is at. Right now, I think it's on her outer arm. They can hit on the inner arm, on both sides, kind of like the way this needle is that I'm about to stick her with. It can go on either leg, either side of the stomach, but after a while, due to the medication, the strength and everything, IV lines, with Angela lately, pretty much any nurse that's came, one stick doesn't work, and if you've ever been given an IV, hand, arm, whatever, can be pretty painful, especially if they start going after the same IV or same arteries in your
Vein.
or veins. What Angela's been experiencing lately is the fact that they've been using the veins pretty often. They've started collapsing on her. They'll stick one vein, it'll collapse. They'll go to the other side of the arm. Normally, lately, 2 sticks have worked. Whether it's 1 or 2, I think there's been a few times she's had to be stuck 3 times, due to once everything shows clear, veins look good, run a shot, run a 5 milliliters of saline through the artery or the vein just to make sure it's good, or through the IV site to make sure it's good. Then all of a sudden, hook up to the bag, and the IV's not dripping. Basically, the vein collapses, so you got to redo the process. Been tasking on both those, whether it be mentally, physically for Angela. Makes it difficult for her taking care of the kids by herself, especially when she's trying to get IV fluids. Like today, kind of gave up today when the nurse was here doing the IV. It was one of those days where one IV or one vein didn't work. It collapsed. Go to another vein. Alright, everything looks good. Hook up to the IV. It collapsed. All of a sudden, Angela turns pale. Blood pressure dropped, I believe, around 84/58.
Temperature was 97.2.
Yeah, temperature is 97.2. Nurse, again, like, you're really pale. I think you need to sit down. Tried standing up, getting a drink to maybe get her blood going. That didn't work. laid her down, room spin and everything else. That's when I got a call at work. Had to rush home, grab the girls, took them to her mom's. Had her she ran IV fluids all day today. Seems to be feeling better. So I think we've went over everything. I just wanted to do this in kind of a video, just showing y'all what we go